Did you know that the Office of Addiction Services and Supports directly operates and staffs addiction treatment centers all across New York State? These centers provide individualized care that support long-term recovery. OASIS staff at each facility are trained at addressing co-occurring or underlying conditions such as psychiatric disorders. Specialized addiction treatment services can include medication-assisted treatment, problem gambling, gender-specific treatment for men or women, and more. OASIS Addiction Treatment Centers provide treatment to all New York State residents, regardless of their county of residence. Most importantly, under New York and federal law, if you have insurance, you have the right to receive addiction treatment services when medically necessary. No insurance? OASIS-funded treatment providers cannot turn you away for an inability to pay. The Bronx Addiction Treatment Center is a 38-bed facility designed to address the basic healthcare needs of each patient while addressing specific physical, psychological, and social symptoms associated with psychoactive substance use. Specialties include intimate partner domestic violence, women and family, criminal justice workshops, Spanish monolingual, co-occurring mental health disorders, and addictions. The CK Post Addiction Treatment Center operates 51 beds for its inpatient rehabilitation program and 42 beds for its community residential program. Services include routine medical care, specialized individualized treatment, and educational services and interventions that address the physical, psychological, emotional, and social symptoms of addiction. Specialties include methadone maintenance, a women's track, criminal justice, vocational readiness training, motivational enhancement groups, co-occurring mental health disorders, and addictions. Creedmoor Addiction Treatment Center is a 26-bed short-term inpatient addiction rehabilitation program for adult men and women. Services address the basic healthcare needs of each individual while addressing specific physical, psychological, and social symptoms associated with addictive disease. Specialties include women's track, homeless men, problem gambling, medical, psychiatric, and psychosocial intervention, self-help groups, individual, group, and family counseling, education, co-occurring mental health disorders, and addictions. The Norris Addiction Treatment Center is a 44-bed inpatient treatment program. Patient services are provided through a structured treatment program which includes a strict set of behavioral guidelines, an intensive treatment program schedule, and individualized treatment. Specialties include problem gambling, deaf and hard of hearing, co-occurring addictions, and mental health disorders. Kingsborough Addiction Treatment Center is a 70-bed inpatient addiction treatment facility serving adult males and females. Cheerfully decorated patient rooms, recreation areas, outdoor patio, and shared dining room all play a key role in establishing a positive environment for the recovery process to begin. Specialties include medically supervised withdrawal, gender-specific treatment, problem gambling, a monolingual Spanish language program, addictions counseling group, self-help resources, special issues groups, social work services, physical and psychiatric evaluations, nutrition assessment, structured recreation, client and family education, co-occurring mental health disorders, and addictions. The Margaret A. Stutzman Addiction Treatment Center is a 33-bed trauma-informed inpatient residential rehabilitation program. A primary counselor coordinates individualized treatment to ensure person-centered care of each individual. Length of stay can range from 2 to 6 weeks. Specialties include women, pregnant and parenting, trauma survivors, co-occurring mental health disorders, and addictions. McPike Addiction Treatment Center is a 68-bed inpatient facility located in Utica, New York, on the campus of the Mohawk Valley Psychiatric Center. The center provides a proven individualized program for adult men and women with chemical addiction. Specialties include a women's track, dual recovery program, co-occurring mental health disorders, and addictions. The Richard C. Ward Addiction Treatment Center is a 48-bed inpatient rehabilitation program providing treatment to adults identifying as female, treating substance use disorders and problem gambling while addressing the medical and psychiatric needs of patients. Specialties include trauma-informed care, acupressure, yoga, mindfulness and meditation, motivational interviewing, cognitive behavioral therapy, anger management, interactive journaling, psychodrama, healing trauma. Russell E. Blaisdell is a 52-bed all-male facility providing routine medical care, psychiatric care, and individualized treatment planning that addresses the various physical, psychological, emotional, and social symptoms of addiction. Specialties include methadone maintenance, traumatic brain injury, nicotine dependence, family education, co-occurring mental health disorders and addictions, aftercare planning. South Beach Addiction Treatment Center is a 30-bed facility which provides short-term rehabilitation to adult men and women suffering with addiction. All treatment plans are catered to the individual strengths, needs, and issues of the person in treatment. Length of stay is based on individual needs of the person served and can vary from 2 to 6 weeks. Specialties include co-occurring addictions and mental health disorders, individual, group, and family counseling, education, self-help meetings, aftercare planning, problem gambling. St. Lawrence Addiction Treatment Center is a 40-bed inpatient rehabilitation program. The evidence-based practices used help patients navigate, embrace, and overcome the challenges and individual encounters in the early stages of recovery. Specialties include medication-assisted treatment, addiction medicine, problem gambling, women's services, criminal justice, co-occurring mental health disorders and addictions. Dick Van Dyke is a 30-bed treatment facility. Treatment services include group and individual therapy, didactic lectures, and presentations, which are used as a teaching mechanism so patients can learn more of the recovery skills needed to continue with abstinence and recovery. Services provided address the basic healthcare needs of each patient while addressing the specific physical, psychological, and social symptoms associated with psychoactive substance use. Specialties include medication-assisted treatment, gender-specific treatment, group and individual therapy, co-occurring mental health disorders, and addictions. For more information on New York State's addiction treatment centers, visit oasis.ny.gov. Oasis, here for you, every step of the way.